Nipah virus? Should seniors be concerned? What you really need to know, you may have seen headlines about a virus with a frightening name, Nipah. So the big question is, should seniors be worried? Or is this another case of fear spreading faster than facts? Let's break this down calmly and clearly. What is the Nipah virus? Nipah virus is a rare but serious viral infection that was first identified in 1999. It mainly spreads from fruit bats. It's also known as flying foxes to humans, sometimes through contaminated food or close contact with infected animals or people. It's important to understand something right away. Nipah outbreaks are very limited and localized. This is not a virus that spreads easily through the air like flu or COVID. Where is Nipah found? Most reported cases have occurred in parts of South and Southeast Asia, including Bangladesh, India, and Malaysia. If you are watching this from the US, Europe, or most other regions, your risk is extremely low unless you are traveling to outbreak areas or in close contact with infected individuals. This is not a global outbreak virus. Why does Nipah sound so scary? Nipah gets attention because it can cause severe illness. It affects the brain and respiratory system. There is currently no specific cure. But here's the key detail many headlines skip. The virus does not spread easily from person to person. Transmission usually requires very close contact exposure to bodily fluids. Prolonged caregiving without protection, this is not casual contact. Should seniors be more concerned? Let's talk honestly. Seniors are not more likely to catch Nipah. But, like with many infections, if infected, older adults or those with chronic conditions may face higher risks of complications. That said, risk depends far more on exposure than age. If you are not traveling to outbreak areas, not consuming raw or unwashed foods in affected regions, not working in healthcare settings with infected patients, then your actual risk is extremely low. Common symptoms to be aware of. Symptoms usually appear 5 to 14 days after exposure and may include fever, headache, muscle pain, sore throat, drowsiness, or confusion in severe cases. It can lead to breathing difficulty, brain inflammation, loss of consciousness. Important note, these symptoms are not unique to Nipah and overlap with many common illnesses. How is Nipah prevented? There's no vaccine yet, but prevention is straightforward. Avoid raw or unwashed fruits in outbreak regions. Avoid raw date palm sap, a known risk source. Practice good hand hygiene. Avoid close contact with sick individuals. Follow public health guidance when traveling. For seniors especially, these are already part of good health habits. What you don't need to do, you do not need to. Panic, stockpile supplies, avoid normal daily activities, isolate yourself unnecessarily. Fear weakens health more than facts do. The bigger picture: Nipah is rare, geographically limited, and closely monitored by health authorities. Public health systems today detect and contain outbreaks far faster than in the past. For seniors, the real focus should remain on managing chronic conditions, staying vaccinated against common illnesses, maintaining immunity through sleep, nutrition, and movement. Those actions protect you far more than worrying about rare viruses. Final takeaway: should seniors be concerned about Nipah virus? Aware? Yes. Panicked? Absolutely not. If you're living your normal life, staying informed, and practicing basic hygiene, your risk is extremely low. Stay calm, stay informed. And remember, health is built daily, not driven by headlines. Nipah virus